Hello YouTube, it is November 26th as y'all can see down below, and I'm here to give an update to one of Actually, I'm going to do two videos. I was thinking about doing both of them together, but then I said no, since they're two totally different subjects, and the video is going to be quite lengthy with just discussing healthcare in general. I'll make it a separate video with foreign policy. So today we're going to go over Marianne Williamson's healthcare policy and why I think she is among the strongest candidates running, in my opinion. Like, number one, Marianne Williamson just covers so many points that nobody else does. It don't make any sense. Like, we done went through all of this before. If y'all, and I'll leave the videos down below if y'all have not seen my previous reviews going over all the policies Marianne Williamson has done. But she literally is the true person that got a plan for everything, and it comes from a place of sincerity. I mean, from women's rights, veterans, the economy, social security, reproductive, racial and reconciliation, Native American justice, including giving back the hills to the rightful Native American tribes, LGBTQ rights, mass incarceration. The list goes on and on. But a very hot topic is universal health care. And what separates her from her other candidates, let's go on ahead and get into it. I'm going to read off her health care, and then I'm going to break it down why she's far better on this subject than Bernie Sanders and Elizabeth Warren, who leads in the healthcare discussion during the Democratic debates. So let's go ahead and get into it. So the biggest problem with America's healthcare system is that it is not a healthcare system so much as a sickness care system. It reflects an outdated perspective on health and healing in which far too little attention is given to the actual cultivation of health and prevention of disease. So she basically describes it right there. That just block right there. This block right here alone separates her from Bernie and Elizabeth Warren, and I'm going to describe later on why. The shift to a genuine healthcare system would involve attention to environmental, agricultural, chemical, and nutritional factors which America's current corporate dominated system of governance would presumably resist. Yet, if America is to deal with our serious issues involving chronic disease and obesity, we must look deeply at the causes of disease and not simply their treatment. The Environment Protective Agency needs to have its power restored as a protector of our environment and thus our health. The Clean Air and I can't talk today, y'all. The Clean Air Act and Clean Water Act must be restored in full, and bans on dangerous pesticides once again vigorously established and enforced. Genetically engineered food should be labeled. The Food and Drug Administration needs to have its power restored so that it can once again guard the American people from toxic substances that should not be on our shelves. And just in case y'all wonder why I'm stuttering on certain words, I do have a cracked screen, so whenever I get to like this side of the articles, it's hard for me to see some of the letters, so that's why I'm struggling on certain words. I don't want y'all thinking I'm illiterate, reading this. No dyslexia over here, boo boo. But anyways, it goes on to say contaminants in our water should be vigorously regulated, and our children's foods, particularly school lunches, should be far more filled with healthy ingredients. Okay, much similar to Michelle Obama on that one. I remember Michelle Obama was a strong advocate of, healthy foods in, K-12 schools when she was the first lady. Until America comes to terms with how much we have acquiesced to the many unhealthy practices that should be considered unlawful, but which are currently allowed in order to increase corporate profits, we will continue to have a less than meaningful discussion of how, as a society, we provide health care. Once again, she's the best one on this subject. The issue of health care in America strikes as key questions regarding America's first principles. Lincoln said we're to be a government of people, by the people, and for the people, and it is ours to decide now whether or not we agree. A government for the people is just that, applying the the resources of our government to providing such a fundamental right as access to health care should be a given, as it is in all other advanced democracies. Those that promote the idea that makes the forces alone should be governed our society have promulgated propagandistic, propagandistic, okay, with the big words now, Marianne, means to dissuade the American people from claiming the rights to universal health care. Words like socialism, too expensive, and nanny state are used to distract us from realizing that with a government of, by, and for the people, which also happens to be in the richest country in the world, universal health care should be seen as the most natural thing in the world and a basic human right. Our government exists to work for us, not for health insurance companies or any other corporate entities whose short-term profits may or may not align with our ultimate well-being. And now, y'all know I'm not the best when it comes to English, but typically this is a no-go right here. You don't start off a new sentence with the word "and." So I'm sorry if I notice a grammar error, honey. Your team's slipping up, Marianne Williamson. But you got a good point going on though. So I'm going to assume that this was an error right here. This is supposed to still be in one sentence. And when we discuss who is going to pay for our health coverage, we should also discuss environmental, food, chemical, and agricultural policies that contribute to our being sick in the first place. Policies that exist to serve nothing more than profit maximizations for industries such as fossil fuel companies, chemical companies, and food companies, health insurance companies, big agricultural companies, and pharmaceutical companies contribute to the chronic illnesses suffered by millions of Americans. And then she goes into policies towards the healthcare, which she explains environmental policies such as gutting the Clean Water Act, overturning bans on pesticides, and disempowering the Food and Drug Administration from properly monitoring our food supply, damage our health, big agricultural policies promoting and subsidizing cash crops over health care options all contributed to the chronic illness that plague millions of Americans. The issue is not just the cost of health care, but the larger cost we are paying. The human cost of being sick so much and so often, just as a cost to our pocketbooks, but the cost to the quality and even length of our lives. The Trump administration has proposed billions of dollars in cuts to the National Institute of Health, Center for Disease Control, and the Food and Drug Administration. If he is successful, I will restore the funding and add even more to it in order to ensure adequate government oversight over policies affecting our health. Okay, once again, I'm noticing another, Marianne, whoever is darn writing your stuff, I notice another error right here. If I restore the funding, see, this confused me. National Institute of Health, Disease Control, the Food and Drug Administration. Okay, she goes to say if. Okay, now I see what's the problem. They forgot an S right here. Yeah, because I was like, why would she frame it as if Donald Trump would do a 180? So I guess she meant if she is successful, I will restore the funding and add even more to it in order to ensure adequate government oversight over policies affecting our health. But the other person forgot the S right here. So with Donald Trump being the previous topic right here, it gave the illusion that she, did a 180 and was trying to credit Donald Trump, but she was saying if she is to get elected, she will overturn it. So I just wanted to point out that correction right there to Marianne Williamson for anybody who looks at this policy and get confused on that line. Policy changes that help prevent and reverse chronic disease and cultivate optimal health will, in addition to helping Americans live more vibrant and healthy lives, save taxpayers trillions of dollars. We need to do more than figure out who is paying for whose disease. Okay, I guess that supposed to be diseases. We need a president who understands the many policies that contribute to America's illnesses, from environmental policies to chemical policies to food policies to agricultural policies to animal policies to pharmaceutical policies, the health of the American people should be of greater concern to the U.S. government than the profit of corporate entities too often not held accountable for the toxicity their products produce. Then it goes to another block, y'all. I'm telling you, she goes real in depth with this. Some would argue that we cannot afford universal health care when in fact that there are studies showing we should spend less money on a universal Medicare for all system than we do now. Moreover, there is no way to measure the amount of money that does not enter our economy based on the fact that so many Americans are too stressed and anxious to create and produce at the level that they that otherwise could. What will I do if I get sick? What would I do if one of my kids gets sick? I hate this job, but I stay because of the health care benefits. Honey, that is so true for so many people. Every one of these questions is a limit on life that will otherwise produce more. This is why we need universal health care coverage. In the richest country on earth, millions of people should not be living with chronic fear and anxiety based on difficulty of providing for the basics of life. The fact that such difficulty exists, it is itself a problem we need to address. For when we do, we face up to the basic inequality of the economic system that dominates our society today. In corporate dominance of our political decision making, because of the undue influence of corporate money on our political systems, has not only corrupted our politics, it has corrupted our food supply, our soil, our air, and our water. In electing me president, America would elevate a leader who understands this and is willing to address it. And in fact, what we have now is a disabled management system, not a healthcare system. Half of Americans now have at least one chronic disease. 4 in 10 have multiple, from heart disease to diabetes to cancer to autoimmune diseases to asthma. Many chronic diseases are preventable even when they have already manifested, and I can contest to that. If treated at their root cause, they are far more manageable to deal with and often even reversible. Everything about American life today, including the economic pressure that leaves 40% of Americans living with chronic stress over whether they can make basic costs of health care, rent, transportation, and education, contribute to higher trend of chronic disease. And then she goes into specifics talking about, I robustly support high quality universal health care coverage for every American. I would do this by making Medicare an option for the Obama exchange. Once again, another win that I like over her. Although she has backpedaled and succumbed to, Bernie Sanders and Elizabeth Warren talking about eventually getting rid of the other options. And I told y'all why that should never be an option to make universal health care the sole thing, because Republicans will eventually get back control, and then you definitely do not want a monopoly on the healthcare industry. So that's why it should always be an option where we all have universal healthcare as a basic right. But if other companies decide to come out and want to match the government or be cheaper, that should still be allowed. So I don't understand that we have common sense to limit, a monopoly in certain areas such as entertainment and everything else. But when it comes to something such as our health, we are proposing that the government somehow has a monopoly on the healthcare industry and do away with all private insurances. No. It's like, once again, if you create a healthcare insurance, universal healthcare that is affordable, by default, all the other companies will have to at least match what the government is offering, because who is going to pay more money to darn gonna get less than what the government is providing? So by default, that'll bring all the other companies down. But if you try to get rid of all of them and make it illegal, what can happen is now the government can bring the prices up once the wrong group of Democrats or Republicans get in And now nobody else can create competition because now the government has a monopoly on the healthcare industry. So I love it if she sticks to this, where it makes it an option on the Obama exchange as opposed to brown nosing to Bernie Sanders and trying to do away with private insurances over time. But I seen her flip flop on that, and I want her to stop flip flopping on that subject. So, Marion, I'm calling you out on that though. I want you to stick to this where you got on your platform. Do not get punked by darn gone the Young Turks with Shank, and darn gone Anna and all of them. Stick to this platform and you be good to go, honey. But going back into the thing, over time, more people will migrate to Medicare. I also support federal subsidiaries to ensure medical coverage for every American, even those in states which have refused Medicare expansion. Okay, so using, your federal authority to, over states' rights. Those who wish to keep their private insurance may do so. Once again, I want you to stick with that, Marion. Do not backpedal and get the brown nose into Bernie Sanders. And this is why I always say, if she gets the darn on nominee, I don't want her to be darn on picking Bernie as the VP. Because I feel Bernie is to Marianne Williamson as Pence is to Trump. You know how Pence has a way of being able to manipulate the current president because he's far more experienced and he can, exude his influence over Trump. I feel the same thing will happen with Marianne Williamson if she allows, Bernie Sanders to be the VP. Not so much if, Elizabeth Warren becomes the VP or somebody else. I would prefer Andrew Yang, Marianne Williamson ticket in my humble opinion, but I will settle since she loves both of them so much, Bernie and Elizabeth, and I know she's going to choose one of them. I'd rather it be Elizabeth over Bernie in my opinion. Because I feel she would stick to this if it's, Elizabeth Warren and a Marianne Williamson ticket. But that Bernie will cause some problems with her. So here's her points right here. In addition, my administration would champion the following policy changes to help change our ill-advised trajectory. Require a healthcare system to reimburse medical professionals for a broader way of lifestyle and nutrition support. Focus on preventing disease and or addressing root causes. Longer visits with doctors and or their support staff to be better equipped patients with skills necessary to make lifestyle changes. Provide patients with more robust ongoing support from nutritionists, health coaches, therapists, and mental health exercise specialists and other peripheral lifestyle treatment providers. Once again, this whole section I think is another point for her over the universal basic income proposals that I've heard from Bernie Sanders and Elizabeth Warren that just focus on healthcare and sickness. Marianne Williamson is very strong on actually preventing the disease from happening in the first place, so you won't even have to, go to the hospital. Like if you had an option of preventing the disease from happening, or if you are in remission and or cured, and you don't want, you don't want the disease to come back. You don't want to deal with subsequent problems post the previous disease. I feel Marianne Williamson has better policies over, Bernie Sanders and Elizabeth Warren. Because she focuses on stuff like nutrition, health coaches, therapists, stuff that typically would not be, under a regular healthcare coverage. Even with what I heard Elizabeth Warren and Bernie Sanders propose, I have not heard them extend to stuff like this, which will be considered, miscellaneous extras on an insurance policy that, maybe some insurances might offer limited quality, but to be given this as a natural right across the board is unheard of. So I definitely give her a point on this one. Then she goes to integrate world-class technology and systems for better collaboration and cost savings amongst healthcare providers, fund programs and our educational systems pre-K through college designed to teach nutrition and lifestyle skills to help cultivate long-term health. Once again, another thing, getting people in healthy eating and healthy choices early, along with changing the what is allowed in the school systems, and stop setting our children up with failure with these artificial milks and everything else that is pushed upon them. Fake cheeses and Everything that's given to them, even the darn snacks that is offered, is darn filled with all types of genetically modified chemicals. The Gatorades and everything that they're taught for the electrolytes, honey, you can get electrolytes with coconut water. Why is you darn drinking a power drink that also has high fructose corn syrup, which disrupts your darn body natural, way to cool down? It interrupts so many of your darn systems in your body. Filling yourself with all those artificial colors just to get some electrolytes that you can get from your fruits, such as your coconut. So that's why I definitely love Marianne Williamson's policies. But going on to restricting the market of overly processed and sugary foods to our children, once again, like I was iterating, especially in the school system, the drinks and stuff that is pushed on to children. She's also proposed changes to the food pyramid, which we're going to get down to here in a moment. Stop subsidiaries and agricultural production of unhealthy foods like once again, right on point, high fructose corn syrup and hydrogenated fats, and incentivizing subsidized farmers, ranchers, and food companies for more healthy food productions, making it more affordable and available. Come on through, Marianne. Shape food policies using cutting-edge public health science instead of following the lead lobbyists for industries whose sole focus is profit. Secure and expand the role of the EPA and the FDA to keep toxins out of our environment and food supplies. And number 10, it goes beyond number 10, honey. Take a national look at stress levels and develop ways to lower stress societally. That means adding vacation time, protecting the manageable work week, and taking a close look at how our electronic devices impact our lives. I told y'all about how the devices emit, what they call electrosmog. And if you can, I will leave a link down below to a little thing that you can put on your devices to prevent that from happening, especially with y'all getting these 5G phones. There is a little thing called, I forgot its name. And it's been so long since I've been with this company, but you can get it directly on Amazon. I will leave it down below to prevent the electrosmog from getting in your system. We'll discuss that in a separate video, though. I can't think at the moment right now. So, going back to the thing, though. We need to develop healthy habits as a community level. Towns and cities can and should look collectively at how active their populations are and institute more ways to increase physical activity through walking paths, bike paths, and community events. The diets of entire cities should be reviewed, as well as that communities can contribute to one another's daily health. The Consumer Finance Protection Bureau should investigate how hospitals overcharge patients, and the Justice Department Antitrust Division should explore ways to remove as much of the profit motive out of medicine as we can. And then it goes to 13. The Center for Disease Control should invest more research into preventing diseases rather than treating symptoms, and look broadly at vulnerabilities in the system, like avoiding pandemics by encouraging healthy disease avoidance behaviors. Once again, another thing right here that separates her. Anybody who takes the time to look at Marianne Williamson's policies and compare it to Bernie Sanders and Elizabeth Warren, you can see with your own eyes that she wins in this category hands down. And the fact that she is not able to be on the debate stage to argue this point and how her policy is way more beneficial for Americans than what Bernie and Elizabeth is proposing is ridiculous. But then it goes to 14. We also need to find a non-pharmacological way to treat mental health issues and take all mental health issues as seriously as physical issues, and reduce the stigma of mental health illnesses so that more will seek and receive treatment. We need to treat drug addiction as a mental health issue and not as a legal activity. Only by decriminalizing drugs we can break back of cartels and drug dealers while getting addicts into recovery. Notice that she mentions all drugs. versus everybody else. They typically just stick to opiates and marijuana, which is majority what white people have been on. Notice they never bring up crack cocaine, which, it was the crack cocaine epidemic that, certain entities, including, what has been put out there, our government has put in black neighborhoods to, bring down economic value of black neighborhoods and to destroy the black family for generations to come. But they never mention about decriminalizing crack cocaine, but you will hear them mention opiates in a different form as far as heroin and pills and everything else, but they never touch on crack cocaine. They make it seem like marijuana is what would benefit majority of black people, but more white people is on marijuana than black people. Now it should be decriminalized, but it should crack should be as well. If you're going to give whole sanctuary cities to predominantly white people who is on heroin, why isn't you giving sanctuary cities and protections to black people who was forcibly put on crack cocaine? So I'm definitely with Marianne Williamson on do away with it with all of now. I still think it should be a critical element there to a certain extent to incentivize them. Okay, if you do not go along with treatment, you're going to jail for some time. So I'm still halfway on that. I don't believe in, permanently fully getting rid of criminal charges for people who are on drugs. I still think there should be a law there where it will encourage them, like give them the option. Okay, I'm putting your ass in jail for 2 years, or you could go to this rehab instead. I feel that is a more fair assessment versus back in the day, they'll just give you 20 years for crack cocaine. So the sentences definitely need to be lessened. The ones currently in jail, there needs to be some charges overturned. And we should be funding money to, increase, drug facilities, which is another thing I spoke on. There is a lack of drug facilities. In North Carolina, there is no drug facilities, inpatient treatment that drug addicts can go to in Fayetteville. You have to go to Wilmington or Charlotte, which is over 4 hours away. Wilmington is over 2 hours away. And then it's like, if you don't have insurance, it makes it real difficult. I told you I've been dealing with this with my own cousin. She had to get herself locked up in jail just to sober herself up. Yeah, the Miss Pissy toilet seat, if y'all follow my darn on personal vlog stories, she purposely got herself locked up to get herself together because she was getting high every other day. She couldn't escape it. It surrounds her. So she had to darn get away from the whole area, and the only option was to do something to go to jail for a couple months so she can sober herself up. But what happens when she gets out in a couple weeks where there's no option for somebody like her? So we also need to address, getting, funding money to increase more inpatient, drug facilities so people like her can actually go there and sober up and have the proper tools not to go and fall back off the wagon versus having to go to jail so they can avoid people, trying to encourage them to get back on the drug of choice that they're using. And then the last thing she goes into saying, this is a mature debate begins on the issue of healthcare. As with most issues, the underlying problems is the corporate dominance of American government policies. With Marianne Williamson in the White House, Americans would be aware that on a daily basis, their persistence is working to realign government policies with the health and well-being of the American people. Right on, Marianne Williamson. Like I said, anybody who just sat here with a half hour and heard me go through this, and you seen the actual platform of Bernie Sanders and Elizabeth Warren's, it does not compare. Marianne Williamson wins this topic hands down. She's the only candidate that also discusses trying to come out with preventative measures and post-care measures for said diseases. Everybody else is just talking about funding the darn system, and that's it. And then, they might also talk about going after the fossil fuel industry, which inadvertently, affects our health and stuff with the smog and stuff in the atmosphere. But they do not go into such intricate details as Marianne Williamson, even with her talking about the food pyramid. And I did a whole video on my natural channel, which I will leave down below, where Dr. Milton Mills has actually went before Congress and told them how appalling it is that dairy products is recommended to us, but a majority of the people in the world have an intolerance to dairy, but because a majority of white people are not intolerant to dairy products, it's recommended to everybody. Over 1/3 of white people have an intolerance to dairy products. 66% do not. But I think they said about 74% of black people, 70 to 75% of Native Americans, 75% of Asians, 55% of Hispanics. We all majority have an intolerance to dairy products. But because the majority of the global minority do not have, once again, the majority in this nation, the minority globally do not have an intolerance to dairy. The majority here, but the minority globally. White people represent about 15% of the world's population. Black and brown people represent 85% of the population. But you're giving dairy recommendations to the rest of us, but 85% of the world has an intolerance. So doesn't it mean that it should be ill-advised, especially when 1/3 of your own race is white people also cannot tolerate it as well? Why is dairy products really recommended for us when you can get your proteins and other nutrients in the form of plants and other items? You got soy milk, you got coconut milk, and the thing goes on and on. You got alternative choices to butter. You got margarine, and the list just goes on and on of the stuff that you can use as dairy substitutes. But it is still recommended to us, and it's taught to our children with the food pyramid as soon as kindergarten. That shit needs to change. And she's the only person who brings stuff like that up. She's the only person talking about actually funding cures for certain diseases. And that's why I said she would be the best candidate when I've also mentioned about people coming out with the alleged cure for cancer. And you don't hear nobody talk about it because it's a black doctor who mentioned a revolutionary way of taking down cancer tumors within the body without deteriorating the skin, without it having to cause thousands upon thousands of dollars. See, under a Bernie Sanders administration, he would just make it probably affordable for treatments to happen in general to keep, perpetuating the illnesses. He will fund, what's already being put out there now, but he would not go the extra mile like I believe Marianne Williamson would, that she would actually seek out this doctor and actually make it where the government will make it where the treatments are definitely affordable for people who suffer from cancer. I feel Marianne Williamson would be the candidate that would go the extra mile and make treatments like that affordable, as opposed to just making it affordable for radiation treatments and all of that actually does harm to the skin, and then you have to come to me to get your skin fixed. For y'all that don't know, I am a licensed esthetician. But yeah, that's what definitely separates her, where I feel she will fund treatments to get rid of cancer. She will fund, HIV. People have came out and said they have found cures for HIV, and you notice they all get ghosts. The government intervenes and we don't hear from them no more. You got people over there, and I fear for my African brothers who darn gonna say there's a doctor talking about he found a cure to cure 90% of people from Ebola. We need to keep mentioning him to make sure he don't disappear next. But I feel with Marianne Williamson, she would actually empower those people and make sure that they're protected and make sure that their treatments are well funded to actually cure these diseases, from Ebola to HIV to cancer. She's the only candidate that I really trust with my heart on this. And this affects me personally, as somebody who is a cancer survivor, as somebody who lives with Crohn's disease, as somebody who lost my job earlier this year from suffering from stress, and it brought on a grand mal seizure. And I haven't had a grand mal seizure in over 8 years. I had my first seizure since, oh no, I'm lying. I did have one at school back in 2012. So I had a grand mal seizure that took me out in 2012. And they had I was unconscious for over a half hour, and they had to get the ambulance and take me out from the school. Other than that, I've had petty mal seizures in between, including rapid petty mal seizures early on, late last year as well. So I've had a series of seizures and almost a borderline stroke because of how when you have so much seizures, it stiffens up your body and it tenses and it shuts everything. It just causes your whole body to expand and everything. It's a lot. So all the tension of the multiple seizures almost caused me to have a stroke as well. So, and all of that has been brought on from stress. The hair loss and everything else. It's the reason why I don't even do hair. I don't even discuss cosmetology because of the fact that how I'm going to do somebody else's hair, and my hair done fell out up here mostly due to stress. Now, some of it could be some male pattern baldness as well, but it's not as likely considering that my maternal side and my father's side I don't know as much, but my maternal side do not really have the genetic markers. I had to take a 23andMe ancestry to see the genetic markers on my father's side, but from what I've seen of him, it doesn't look likely that as well. But it has been exacerbated due to the stress nonetheless, because my hair has thinned out all over. It's not just in this section right here. Even the sides have thinned out considerably considering my videos in the past. All of that stress related, lack of proper nutrition, not being able to get the right nutrients and stuff, etc. And then my insurance, that high dollar insurance makes you want to cut corners. So having a public option would definitely help out people such as myself, where I would not have to take a quarter of my earnings and it's being deducted for doggone basic insurance, because with people like me, we get penalized. People who have previous diseases such as Crohn's disease, and once they hear cancer, they're going to jump the price right on up. If you are lucky to even get insured at all, they darn gonna penalize you from darn gonna surviving the disease. If you are blessed to darn gonna be a cancer survivor or be somebody who is managing your Crohn's disease, you get punished by these insurance companies for having a disease or surviving something such as cancer. And when I see Marianne Williamson talking about actually funding cures for diseases, that speaks to me more than more than Bernie Sanders and Elizabeth Warren talking about just funding for the government just to pay for me to just continue the drugs that I'm already taking. I'd rather not have to take the drugs at all if I can help it. And if you have somebody such as Marianne Williamson talking about if she's to become primitive to doctors such as, Dr. Milton Mills and his recommendation of, the dairy products should be taken off the food pyramid, which she has mentioned. And I think she actually mentioned Dr. Milton Mills as well in her many press tours that she has been on. Also, if we can get her familiar with the doctor that was on the Roland Martin show, that would be good as well. In addition to the doctors that have shown treatments to get rid of HIV/AIDS, and the list goes on and on. And even foreign policy, the doctors over abroad with getting rid of Ebola. I've also heard about people talking about treating sickle cell, which kills a lot of people. A lot of people say that you would be blessed to even live beyond the age of 35 if you have sickle cell. And my Aunt Glo has sickle cell. She's blessed to be 50 years old and still has it under control. Lovely T, I know, Nigerian YouTuber, she battles sickle cell. It puts her in the hospital from time to time. And she's blessed to be over the age of 35 and still she deals with the debilitating conditions of sickle cell, but she's one of very few people who be able to get over 35. T-Boss is another one, from N.I. Creeper. Hey, N.I. Creeper. From the TLC group. She is a person who is living with sickle cell disease. So if we have a candidate that's talking about not only creating universal health care, but making it where you get rid of diseases where we don't have to go to the doctor perpetually for our diseases in the first place, that strikes more home with me than somebody who's just, oh, well, we just going to make it more affordable to you. That's what I hear when I hear Elizabeth Warren and Bernie Sanders. But when I hear Marianne Williamson actually speak to people like me directly, I really, I have nothing but applause for Marianne Williamson. This is why, this alone, she would get my vote any day over Bernie Sanders and Elizabeth Warren on this issue alone. This is revolutionary. When you're talking about fully addressing the corruption, not just saying, oh, we just going to make it more affordable, but we not really going to address the corruption. When she's talking about really changing and destroying the pharmaceutical industry, honey, this is why I love Marianne. I've grown to have much love and respect for Marianne Williamson. Even though I still think she should change that, we had to discuss about the reparations, honey. But this alone, outside of reparation, she should darn gonna win the presidency. She should win the presidency. It is nothing more important than our health. And the pharmaceutical industry has been messing with our health. These insurance companies have been getting away with jacking up our prices. A quarter of our paychecks are going just for basic darn on insurance at the darn on maximum, when we should have the maximum insurance benefits at the minimum in the richest country. So, once again, I can't give nothing but utmost praise and respect to Marianne Williamson. So, what are y'all thoughts on this? Like I said, in my opinion, she beats darn on Bernie Sanders and Marianne Williamson. She beats Bernie Sanders and Elizabeth Warren hands down on this issue. Marianne Williamson, in my opinion, is being highly slept on. I don't understand when it comes to universal health care. I always just hear Bernie Sanders and Elizabeth Warren, but I never hear Marianne Williamson, who is actually talking about targeting what is causing us to be sick anyway. The corporations and the U.S. government, in a way, keeping us sick for profit. We are a country that thrives off of funding of the sick instead of actually, coming up with a cure for the illnesses. It's a shame when you still have these cancer societies and everything that gets these millions of dollars in donations, but it's never funded to people who've actually shown proof before court. They have been subpoenaed to court, and they've won their case every time with showing that they have came up with legitimate cures from what they said. And I ain't have to say alleged, so YouTube, you try to strike this darn old video if you want to. Because I know how y'all is when people say a cure when it comes to diseases, but it has been proven in a court of law. So this ain't alleged. There has been cases proven people have doggone being permanently put in remission for their cancer, HIV, etc. by doctors. And then we do not hear no more from these doggone doctors. But we still get these alternative medications pushed out to us, and then a couple months later, here comes the doggone recall. Just like with that latest HIV drug that they was trying to get people on the preventative medication, and you seen the ad with the interracial gay couple, the trans woman, the black woman, the black man, the white gay couple, and everything else. And then it ain't even been out a couple years, and now I'm already seeing recalls and side effects with that. But you're not funding the actual drugs that has been proven to get rid of the disease permanently. Not darn gonna treat it. You charging $2,000 for that pill that's being recalled, instead of funding darn on affordable medications and treatments so people like us won't have to suffer. People who suffer from Crohn's disease, ulcerative colitis, dealing with cancer today, or a cancer survivor, dealing with epilepsy, dealing with sickle cell. We're tired of doggone just, dealing with perpetually having to treat the problem. I am definitely for Marianne Williamson and addressing the problem and helping us get rid of the problem. So what are y'all thoughts on this below? Like I said, this doggone affects me personally, and I feel personally that she is the best one that has addressed us. Nobody else has gone in such intricate detail and has actually been bold enough to take on the pharmaceutical industry as Marianne Williamson. Everything else I hear from everybody else, from the top two people that's mentioned with healthcare, the only thing they mention is, just funding the problem. But we need somebody who's not only going to help us fund, healthcare, but somebody who's actually going to prevent us from having to use the healthcare in the first place. And that candidate is Marianne Williamson. So that is why I think Marianne Williamson is more deserving to be on the debate stage, and she should be able to argue this point over the other people they got in there. Hell, you got Tom Steyer just taking up darn empty space, along with quite a few others. We don't now somebody else darn mention that they getting in the race, another billionaire, and it's like, what is your policy? But y'all leave y'all thoughts down below. Feel free to like, comment, share, and subscribe, and I will see y'all soon with more videos. Mwah.